Hi, nurse practitioner, functional nutrition, and fitness coach Nicole here to talk to you about postural orthostatic tachycardia syndrome. Well, we can drop the orthostatic part, and we call it POTS, P-O-T-S. Now, as always, these videos are for information purposes only, not meant to diagnose or treat any one person. So, POTS is a disorder characterized by orthostatic intolerance, which is the ability to remain in an upright position without symptoms. This is due to abnormal autonomic response from the autonomic nervous system, which is responsible for the automatic regulation of blood pressure, heart rate, breathing, digestion, and sexual arousal. Symptoms of orthostatic intolerance include lightheadedness, dizziness, blurring or fading in vision, generalized weakness, fatigue, palpitations, you feel the beating of your heart in your chest, mental clouding, anxiety, nausea, dyspnea, which is shortness of breath, or headache. The clinical syndrome of POTS includes intermittent symptoms of orthostatic intolerance accompanied by high heart rate without the normal compensatory lowering of the blood pressure that we'd expect to see. POTS is different than orthostatic hypotension, where we do see a drop in blood pressure with standing. Reflex syncope, which is fainting with prolonged standing, is present in about 6% of patients with POTS. The ability to stand up against the force of gravity takes a considerable amount of muscular strength, bone strength, alertness, and proper functioning of the cardiovascular autonomic system to compensate for the downward displacement of 500 to 800 milliliters of blood that goes down into your abdomen and into your legs. We need a way to be able to recirculate that to keep perfusion to the brain so you don't pass out. In the case of POTS, there's likely more than one mechanism at play here causing these symptoms. So potential underlying causes, we typically see hypovolemia, which is low blood volume, and deconditioning, as though the person has been in bed rest for several days. While increasing physical activity gradually and with guidance and improving conditioning does help with symptoms, it doesn't completely alleviate it, indicating there's something else going on as well. Some patients with POTS have evidence of neuroendocrine dysfunction, meaning the chemical messengers within the body to control blood pressure and heart rate are either too high, they're not being metabolized right, they're not being absorbed right. Something is going on there that's causing these symptoms. A small fibroneuropathy, which is damage to the nerve cells that can cause that numbness, tingling, burning sensation, that may be present in up to 50% of patients with POTS, and it is typically accompanied with other GI symptoms like nausea, abdominal pain, bloating, and constipation. Finally, a small number of POTS have been correlated with a viral illness, leading to an autoimmune response in which the immune system fails to recognize the self and starts attacking certain parts of the body. We've even seen this post-COVID. In upcoming videos, I'm going to go ahead and discuss the diagnostics for POTS and other conditions we want to consider while we're figuring out what's actually going on here, and also the treatment, including diet and lifestyle. As always, you need to seek out the help from a qualified health professional if you or someone you know is suffering from these symptoms. If you found this video helpful, please like, comment, and follow or subscribe so I can continue to deliver more information to you guys and educate you about your health. So be your own advocate and go take charge of your health.